So in this video today, we're continuing to talk a bit more in depth about the IVF process and what it actually involves. And this is going to be a fairly short video because we're just going to talk about the egg retrieval itself. So this is the surgical part of the procedure. It's known by many names: egg retrieval, oocyte retrieval, OPUs. But in essence, it's where we think the follicles have grown big enough. We've triggered the follicle, and at the time that we've allocated after the trigger, we're about to come in and retrieve the eggs. Most of the time, this is now done under general anesthetic. Certainly when I first started practice, about a third of my patients were doing local and sedation and 2/3 general. But I think increasingly now, almost all my patients are choosing to go down the general pathway. I mean, whether you do general or local, it doesn't really matter from an outcome perspective. The only instance where we would recommend a general over a local, specifically if there's a discomfort issue. So some patients just don't tolerate this procedure very well if they're awake, or if there's an anatomical issue where we expect the egg retrieval to be a little bit more tricky than what we normally would anticipate, and therefore we need to push a bit harder, and therefore general anesthetic can just alleviate a lot of that discomfort. About 90% of our egg retrievals are done through the vagina, and in essence, it is essentially a glorified transvaginal ultrasound. So really what happens when an ovary gets stimulated and produce lots of eggs is that they actually get quite big compared to what they normally are. And as the ovary grows in size, it sort of descends into the pelvis and gets really quite close or even touches the top of the vagina. And therefore it's relatively straightforward for us to do an internal ultrasound and access the ovaries that way. The ultrasound machine that we use is almost exactly the same as the machine that you guys have been used to doing the tracking. The only difference is that the probe that we put on the inside has a groove in which runs a thin needle. That needle passes through the top of the vagina. Once the ultrasound probe has located the ovaries, it goes through the vagina into the ovaries and into each follicle. We enter each follicle systematically. We drain the fluid. Now we can't really see the egg on the ultrasound, we can only see the fluid and the follicle, but we're hoping if the trigger's done its job, the egg is good enough quality, then it will have released itself from the follicle, and when the fluid gets drained, the egg comes along with it. I think it's important to understand that we will drain every follicle that we see, but not every follicle will give us an egg. Generally, follicles over 15 millimeters in diameter are what give us an egg. Follicles over 22 millimeters generally don't give us an egg either. The recovery time for this procedure is generally quite straightforward. Most of our patients spend about an hour in our recovery unit. They then go home. We would recommend no work on that day of the procedure, and essentially take it easy the next day as well, but it should be better the day after. Pain relief is either via sort of simple analgesia, simple pain relief of paracetamol, or if needed, we can give something stronger. Sometimes due to a whole variety of issues, so for example, whether there's an access issue due to an anatomical variant, such as big fibroids that push the ovaries quite high up, we may actually need to do the egg retrieval through the tummy or through the abdomen rather than through the vagina. It's not ideal, but it's still doable. And really the main issue with doing abdominal egg retrievals is that there's more organs in the way. So for example, if a loop of bowel happens to be sitting in front of the ovary, then we really can't go through the bowel to get to the ovary, and it's just a little bit more difficult to see through the ultrasound. Sometimes, for example, in cases of endometriosis, the ovary is stuck behind the uterus, so we then end up doing something called a transmyometrial egg collection. So that is, the needle passes through the muscle of the uterus to the ovary that's sitting behind it to retrieve the eggs. Most of the time, if we do these slightly more complicated egg retrievals, we do give some antibiotic cover just to prevent infection. And also in other instances such as endometriomas, we would also give antibiotic cover as well. So that really, in a nutshell, is what an egg retrieval is. It is the surgical part of this component, but it's a relatively small procedure and the recovery should be very quick. You should recover day by day. If you take a giant step backwards, that's when you really need to let the medical teams know. So next video, we're going to talk to some of the more interesting stuff that goes on in the lab, especially with the insemination and embryo culture.